Assalamu alaikum. Now I would like to talk about the ADHD and ASD, very high topic of psychiatry. Okay, start with my intro. Can you hear this? I'll tell about this sound at the end of my video. Okay, ADHD, Attention Deficit Hyperactivity Disorder. In ADHD, inattentive and hyperactive impulses for more than 6 months. So inattentive and hyperactive impulsive symptoms for more than 6 months. So inattentive symptoms, hyperactive symptoms. These two words, inattentive symptoms are difficulty focusing, distractible, does not listen or follows instruction, disorganized, forgetful, loses or misplaces objects. Hyperactive is fidgety, unable to sit still, driven by a motor. Hypertalkative, interrupts, blurs out answers. ADHD. So the diagnosis should be more than 6 month inattentiveness and hyperactive symptoms. These inattentive symptoms are hyper more than 6 months, and several symptoms present before age 12. Several symptoms present before age 12. Symptoms occur at least two settings. Symptom has to occur in two settings like home, school, and cause functional impairment. Subtypes: predominantly inattentive, predominantly hyperactive or impulsive, and combined. Predominantly inactive, predominantly hyperactive, or combined. So words are predominantly. Okay, in here in ADHD we can use the stimulants like methylphenidate and amphetamine. The AM can be used. Amphetamine and methylphenidate, these are the stimulants. And if a mother wants a drug which is non-stimulant, then we can use atomoxetine. This is the first line, and the other second line drugs are guanfacine and clonidine. These drugs can be used. These are non-stimulant. So stimulant drug are amphetamine and methylphenidate. The side effects are weight loss, decreased appetite, insomnia, abdominal pain, tachycardia, hypertension, tics, and addiction potential. This is the main thing, addiction potential. This is the concerning fact. That's why some caring mothers do not want stimulant to give as a drug for treatment in ADHD. They prefer non-stimulating. So atomoxetine can be given. Atomoxetine causes dry mouth, decreased appetite, insomnia, hyperhidrosis, and erectile dysfunction. And clonidine and guanfacine can be used. It can the side effect is night disturbance, hyperactive. So ADHD continues to the childhood in 50%. Patients may be concerned about stimulant adverse effect of their children. They should be informed that stimulants are highly effective for ADHD and generally well tolerated. Common adverse effects such as insomnia and appetite stimulation can be managed strategically. Given stimulants earlier in the day to prevent insomnia, large monitoring meals prior administration to counteract decreased appetite. Methylphenidate first line for ADHD but should not be used in patients age less than 6 years. So methylphenidate cannot be used in child less than 6 years. Behavioral therapy is the first line for preschool children. Behavioral therapy is the first line in preschool children. So less than 6 year behavioral, more than 6 year. First line is atomoxetine. This is non-stimulant. That's it is preferred as the first line. So less than 6 year behavioral therapy more than 6 months to make certain. Okay, now ASD, autism spectrum disorder. Deficits in social communication, impaired social engagement, back and forth conversation, impaired non-verbal communication, eye contact, gesturing, and difficulty developing or understanding relationship interest in peers. Restricted repeated patterns of behavior, restricted repetitive movements of speech, insistence of sameness or routine, intense fixated interest, adverse responses to sensory input, texture may occur with or without language and intellectual impairment. And autism is from early diagnosis and intervention, comprehensive multimodal treatment, and adjunctive pharmacotherapy for psychiatric comorbidities. Language delay without an attempt to compensate through the non-verbal means of communication is a character. Language delay without an attempt to compensate through non-verbal means of communication is a characteristic of the ASD. The diagnosis of the ASD is clinical one, involve comprehensive evaluation including structural assessment, social language, intellectual development, in addition to hearing, vision, genetic testing. Young children often prefer food group which is consistent with normal development. However, when picky eating is accompanied by behavioral rigidity, poor growth, weight loss, developmental delay, and further evolution is indicated. And the last is IED, intermittent explosive disorder. Intermittent explosive disorder are characterized by recurrent episodes of impulsive verbal and physical aggression onset age after 6. The aggression, the aggressive behavior are unplanned and out of proportion. These are unplanned. Intermittent explosive disorder, the aggressive behavior is unplanned and out of proportion to the provocation, out of proportion to the provocation, and lasts less than 30 minutes. Embarrassment and remorse and SSRI psychotherapy. The differential diagnosis mania, DMDD, disruptive mood dysregulation. Person is constantly angry between the episodes. An onset age before 10 and not made after 18. Stimulant and antipsychotic should be given. So that's all about ADHD, ASD, and intermittent explosive disorder. Now listen to the murmur again along with my intro. So can you guess? It's S3 gal. Okay, that's all for this discussion. Hope you enjoy. And if you like my video, please subscribe, share to your friends. Thank you.